Welcome to the Friends of Zane Adams, aka FOZA podcast, bringing awareness of postpartum depression, suicides, and the children who are left behind. We'll be spotlighting positive outcomes from mothers as well as healthcare experts and counselors. Would you know the signs of PPD? Would you know how to help a loved one? Stay tuned. As a community, we can do more to support maternal mental wellness.
Greetings, everyone. This is Paulette Smith with Friends of Zane Adams, aka FOZA Inc. We are a 501c3 nonprofit dedicated to bringing awareness and resources to support sufferers of postpartum depression, to prevent maternal suicides, and to support the children who are left behind. We strive to stop the stigma, the silence, and the suicides, the suffering that often accompanies maternal mental health issues. Now, before I begin, I need to say a few words about triggers. This is a safe place. However, we may discuss topics that can be sensitive, and we just want you to know that the content we discuss serves to provide information and educational advocacy purposes only. Now, if you feel like you're experiencing an emergency, want you to stop the broadcast and call the National Suicide Prevention Lifeline. That's 988. If you're not experiencing an emergency, but you still want to get a hold of some resources and you can't afford consultation, please visit FOZAinc.org and provide your contact information. We'll try to assist you in finding resources in your local area. And remember, you're not required to provide any private or sensitive information. I also want to remind those who are listening to the audio-only version that FOZA Podcast is also shown on YouTube, where you can view slides and share visual information. Please subscribe to our YouTube channel because it supports our work and broadens the awareness of resources available for mothers, professionals, family members, and the community. So visit us on YouTube at FOZA Inc. Click on the subscribe button and turn on notifications too, so you'll know when a new episode is broadcasted. I want to thank you again for being here with FOZA in another episode all about awareness of related maternal mental health issues. And as you know, the month of May is recognized as National Mental Health Month and National Maternal Mental Health Month. The perfect opportunity for us to highlight a few of the resources we work with, to draw data from, and to help our audience become more aware of some of the successes as well as the challenges we face as mothers, families, and in the community. Now I'm going to jump right in and start out by saying there are hundreds, and I dare say thousands, of wonderful organizations with our common goal. The goal is to bring more awareness to maternal mental health. Now, because we're a small nonprofit, we have aligned with several other larger nonprofit organizations to help us learn, to grow, and to support our communities at grassroots level. I'm going to start with PSI, Postpartum Support International. And it's just that, an international organization with a well-known signature statement. You are not alone. You are not to blame. Help is available. You will get better. So if you've heard that phrase before, then you're already aware of PSI. They were founded in 1987. They're based in California in the U.S., and they're dedicated to increase awareness among the public and professional communities about the emotional changes that women can experience during pregnancy and postpartum. When the mental health of a mother is compromised, it affects the entire family. And PSI's mission is to promote awareness, prevention, and treatment of maternal mental health issues related to childbearing in every country in the world. Now, FOZA joined PSI because while it does indeed operate worldwide, They have local chapters that work in ways to help individuals, communities, and smaller organizations like FOZA stay informed and stay relevant. Organizations like PSI make it easier for smaller organizations like FOZA to help mothers find the resources they need locally and stay with them through the exploration process to get real help for real problems. Another organization we align with is Policy Center for Maternal Mental Health. In the early days of FOZA, we looked for well-established organizations that were openly discussing the difficult topics like maternal suicide. After all, the tragedy in our own family sparked the passion to learn more about postpartum depression and the ultimate tragedy of suicide. And our research led us to an organization named 2020 Mom, which is now known as Policy Center for Maternal Mental Health. They welcomed our inquiries, they welcomed our story about our Christina, and we immediately began to learn that maternal suicide is a leading cause of preventable maternal deaths, and it garners more attention through the support of state and federal reporting efforts. And that's what they do. They bring forth that awareness through a state and federal level. Reporting not just important about the deaths, but the entire journey that could lead to a death. And we find that is woefully lacking in the needs more attention from frontline providers like OBGYNs and others to close the gap. And mothers in the area of screening and detecting suicide risk, there's a lot of work to be done there. And that leads me to step away from the larger organizations for just a moment to mention individual professionals who have aligned with FOZA. Just going to highlight one in this podcast, but they advocate for better maternal mental health care. And one of these great professionals is Dr. Alan Lindman. He's an obstetrician with more than 4 decades of practice who's dedicated many years to awareness, prevention, treatment, and aftercare of perinatal and postpartum mothers. Now, I point out Dr. Allen, he's known as Rural Doc Allen, because he has more than 6,000 births to his credit with 0 mortality rates, primarily due to his experience, his vision, and his mission. He also has a library of online resources to answer many questions in a professional manner for mothers to reduce a mom's stress level on issues that may be silent with her. She may be keeping silent about it, but she knows that she's getting real professional advice, and he works with the existing system that she's in. He's very knowledgeable, and we stay connected to Doc Allen because he's dedicated to the prevention, not just the awareness and the treatment, but the prevention of PPD. And he's currently in the process of forming some resources that will even better facilitate moms. So I want you to stay tuned for updates. You know I'm going to bring them to you. Now, we've come to be aware of many challenges that moms face. Some only are addressed or corrected at a level that's community-based. Some better faced and corrected at a state level or federal level. And that's why FOZA aligns with Mom Congress. That's an organization initiated in 2017 by 2020 Mom. They had a focus to pass critical maternal mental health laws and legislation because a lot of challenges they just can't be taken care of unless they're looked at from a nationwide level. Now, 5 critical bills have become law, and that's in 2022. A lot of activity is going on, but I just want to talk about the 5 critical bills of 2022. I'm just going to give you the highlights here so you can learn more about each one by visiting momcongress.org, or you can visit FOZAinc.org because we put the highlights of the legislation in our site. Put legislation in the search box and get more. But for right now, 5 big ones. Now, the first one is Data Mapping to Save Moms' Lives Act. That's Data Mapping to Save Moms' Lives Act. And this bill looks at locations in the U.S. where there are high maternal mortality rates and want to increase the broadband access to provide telemedicine to those locations. A lot of people may not know that the Federal Communications Commission has a broadband map. We want to incorporate that data on maternal mental health outcomes into that system, into those health maps. This is important because, as we all know, the more accurate data leads to better funding, and better funding leads to better health care. Number 2, Pump for Nursing Moms Act. The Pump for Nursing Moms Act will strengthen the break time laws, and it will expand protections for lactating mothers. Breastfeeding in itself can be very demanding, and adding the worry of break time at work can be a great equation to another silent stressor. So lactating workers will get that Pump for Nursing Mothers Act into their workday, and we're hoping that's going to be a great stress breaker. Number 3, the Pregnant Workers Fairness Act. This bill requires employers to make reasonable accommodations to support the health of pregnant workers. Just want to make sure that we're looking at mothers and birthing people, providing reasonable accommodations. Next, Triumph for New Moms Act. Triumph calls for formation of a temporary federal interagency task force to coordinate efforts to address maternal mental health and to create a national strategic plan, including recommendations to state governors, House and Senate committees, representatives, and relevant federal agencies to support and improve maternal mental health in the U.S. This is where we as individuals and small nonprofit organizations can find roots into communicating with our state officials. And we, of course, we'll start county level, state level, federal level. Having Triumphs for New Moms Act will help build inroads for that. On to my last, but in no way least, a law that was passed in 2022, Into the Light for Maternal Mental Health. This provides permanent mental health resources across the country to pregnant and postpartum people, including a 24/7 voice text hotline, which has already been activated as the National Maternal Mental Health Hotline at 833-943-5746. Now, along with a $170 million grant of funding to states to create more perinatal psychiatry access, all of the programs under Into the Light for Maternal Mental Health are pledging to collaborate, share lessons learned, and improve the overall quality, impact, and stability of mothers and pregnant people. Now, if you were not aware of these laws or some of these programs have spawned from many different organizations, and now you're aware of them. Some of the laws have been in progress for many years, and as I said, many organizations and individuals have worked together to generate enough concern to bring the laws to fruition. So it's important that now we do our part. We all know the story does not end by simply putting a law into place. We have to share information and follow up on how well it's working. These federal laws can bring a positive change to moms on all levels in cities, counties, states, and nationally. At the time this broadcast is being published, HRSA, that's HRSA, U.S. Health Resources and Services Administration, is still accepting funding applications for states and tribal organizations in the area of screening, accessing, treating, and referring mental health conditions in pregnant and postpartum people. So if you're a nonprofit organization in this space, check your state representatives, check with them, and learn if your organization is eligible for any of this funding and take advantage of it. If you're an individual who advocates better maternal mental health care, and any of these topics touches your sensibility, don't just sit idle. Follow up and learn more about what you're interested in. Use your social media clout to spread the word and continue to work for improvements or adjustments in the laws wherever necessary. Wow, my time is winding down, and I don't want to leave you with the impression that FOZA works only with the organizations that are large. I'm highlighting a few of the large ones here, but I also, if you're looking at this, getting this podcast on YouTube, you can see a list of many that we work with. But the best way to find out all of the organizations that we align with and that we personally checked out is to visit our website at FOZAinc.org. That's F as in Frank, O, Z as in zebra, A, INC.org. Now we understand that sometimes you don't want to dive into a huge organization trying to find out what works and what doesn't work for you. That's why we're standing by with FOZA Finder to assist you with individual information at a local level. I still want to repeat that FOZA is not an emergency service organization, so if you feel you're experiencing an emergency, you want to call the National Suicide Prevention Lifeline at 988. But if it's not an emergency, you still need help, you still want to speak to someone, and you can't afford consultation, please, first, check with your immediate medical service provider, your circle. If they're not listening or you feel like you're not being heard, contact FOZAinc.org and provide your contact information, and we'll try to help you find resources in your local area. And remember, you're not required to provide any private or sensitive information. Well, FOZA fans, that's it for this episode. I want to thank you on behalf of all who are involved for tuning into the podcast. I want to thank you for everyone who's concerned about maternal mental wellness. I hope that this information I've shared with you today will lead you to more self-care for you, because you so richly deserve it, and to spark you to help others. Help moms, deserving people, and families and communities just take care of one another. I want to give a special thank you to family members and caregivers, because we know that when you're listening, you're learning and you're caring, and we hope that you'll share this information. We appreciate you. Ask you once again to visit our website and click on sponsors to check out some of the awesome packages we put together for businesses, local and around the nation. Your single donation is important too. Every dollar goes towards bringing awareness to maternal mental health. So once again, this is Paulette Smith signing off in loving memory of Christina LaShawn Thompson Adams. Bye-bye now.